So this young man, 32 years old, came to us with a history of hair loss expanding to around 9 to 10 years. He had a very natural hairline, very good growth of hair. His confidence level came up very high after this hair transplant. Can a hair transplant change your life? Let's dive into the possibilities of a life-changing hair transplant by discussing this particular case which we have brought out for you today. I would like to tell you about how you yourself can be a part of your own planning of hair transplant and can get a peek of what kind of results you can expect after the hair transplant. So this young man, 32 years old, came to us with a history of hair loss expanding to around 9 to 10 years because of some social concerns and all. He was planning a hair transplant so that he can improve upon his look. When he came out, he was slightly low on the confidence side. He said that he looks slightly older for his age and feels awkward whenever he is in the company of his friends. Those were the motivational factors for which he came out for the hair transplant. The grade of baldness was Norwood Grade 6 in his case. There's a thinning extending up to almost the crown or slightly lower than the transition zone, and his humps on the sides were preserved. We did his trichoscopy first, and we found out that the density in his donor site was on the lower side. It was 76 follicular units per centimeter square. His average hair thickness was 0.063. His donor area was around 130 centimeters square. With this 130 centimeter square area and an average density of 76 follicular units, he had around 10,000 follicular units available at its donor site. Coverage value was also on the lower side. It was 10.48, which is not very good. Please like the video if you are liking the way we scientifically go about planning a particular hair transplant. So in his case, we did plan from the existing hairline where he had some thinning hairs up to the transition zone. This area, when we calculated, was around 100 centimeters square. We decided on a density of 35 follicular units per centimeter square. The grafts which we planned for him and we did for him were 3,526. The hairs in those grafts were 7,745, giving an average hair yield per follicular unit to be around 2.19, which is good. Distribution of 1, 2, 3, 4 hair follicular units is shown on the screen to you. If you are also planning your hair transplant, or friends or family persons are planning a hair transplant, you can either write down in the comment section below, or you can call us at the numbers, or you can WhatsApp us your pictures and we will try to reach out to you as quickly as possible. So coming to the procedure itself, we marked his hairline, the mid frontal point, at around 7 cm from glabella. After this, we did the trimming, gave the local anesthesia, made the slits or the sites were created using very fine, precise cut to size blades. After making the sites, we started the extraction of the follicular units from the donor site, and we took out the required number of grafts. Around 3,500 follicular units were taken out. In our machine, we have a counter which showed him the number of grafts, and the punches are also the best quality, and we use a single punch which is not reused in any of our cases. After the grafts of follicular units were taken out, they were sorted out or segregated into 1, 2, 3, 4 hair follicular units, and then our technical team started the insertion of the follicular units into the sites created. After this complete procedure, which lasted for around 6 to 7 hours or even more, we finished the entire procedure. The patient was absolutely comfortable after the procedure, and then he was in close touch with us and kept on coming routinely for the PRPs, was taking the medicines very religiously. By the time he came at around 3 months, we could see a very good growth, and we were very confident that the kind of results we can expect in his case were going to be very good. Successively at 7 months, he came for the follow-ups. We did his PRPs, we took out his combing videos, and we could see that he had a very natural hairline, very good growth of hair. His confidence level came up very high after this hair transplant. He is very happy, extremely happy. This is what we did in his case, and the kind of results, just 7 months, what we could achieve in this particular case. We request you to subscribe to our channel to keep on watching such useful information about hair loss, hair transplant and planning of these results. Coming to the app we're talking about, it's a Saraswat Hospital app. It has a very simple process of downloading, installing, taking a quick quiz, uploading your required information and using the PeekAI features, and then after an input from our ABHRS doctors, me and Dr. Preeti, our artificial intelligence algorithm provides you with the kind of results you can expect. Although they are not absolutely accurate, there can be some changes to that also. There can be some discrepancy or differences also, but still it gives you an idea about the kind of results. Also, it tells you about the number of grafts, and as well as it gives you a list of 10 questions which you should be asking your hair transplant doctor from wherever you are planning your hair transplant. In the end, I would like to touch upon a few points. Please plan a hair transplant from a clinic which is well invested in you. Planning your hair transplant after trichoscopy, going about the planning in extreme details. They are discussing your medical treatments, the pros and cons of medical treatment in detail which you have to take after the procedure. Preferably, ISHRS and IBHRS doctors should be doing your hair transplant surgery. These are the premier bodies in hair transplant restoration field. Choose a doctor who he or she is routinely attending all the best of the conferences world around and sharing their information as well as gaining these latest information from these conferences. And last but not the least, choose a clinic which is very, very transparent about the cost as well as the number of grafts which have been extracted in your particular case. We request you to share this video with your family members, friends or colleagues who are planning a hair transplant. Do watch the video on the left to know more about our Saraswat Hospital app to show your results. If you want to see the results of one of our latest hair transplant patients, please click the video on the right.